Okay. I'm Counsellor Robert Johnson, and I live in the London Borough of Brent. I actually live in Wembley, and I am the counsellor for the Northwick Park ward. Northwick Park has been in the news because of the amount of COVID transmission in the hospital, which had one of the highest back in March and April of last year. And my role is actually making sure that I assist the community in any way I possibly can. As a local councillor, you try to deal with residents' issues where the council can support them and help them, and that's one of my roles. I also am a member of a local church, and I actually try and help out. We have a food bank there, we have a Saturday school there, and we try and do lots of things for the community through our church.
Okay, that's great. So our first question is, have you had the vaccine? And if not, what are the largest barriers stopping you from taking it?
Right, well, I have had both shots of the vaccine. And one of the things that I have done is actually promote taking the vaccine in our church, so that we have, every week we have a pop-up clinic. So a minimum of 100 people every week gets the COVID vaccine at our community hall. I think one of the biggest things that puts people off, especially from the Black community, is issue of trust. A lot of Black people don't trust the government. They don't trust people in authority because of what the things that's happened in the past. And I know that bad things have happened, and what we have to do as a people is to actually look at what is best for us. People have to make their own choices, but at the end of the day, if you are having a lot of Black people in influential positions saying you should take the vaccine, there must be a reason for them saying that.
Very true. So I guess there is quite a bit of hesitancy surrounding taking the vaccine itself.
Mm-hmm.
So are there any myths or misconceptions that you've heard about the vaccine?
Well, yes, I've heard quite a few, and I sometimes debate it with quite a few guys who are around my age, who are from the old school, who just doesn't believe anything that the government say. Like, for instance, they're trying to put a chip in so that they can trace us and do whatever they want to do. And I said, well, they don't need to do that. They've got your mobile phone. They could trace you wherever you want. So why go to the extent of putting a chip in the vaccine? It doesn't make any sense. So that's one. The other one is saying that you've got to make sure that you have your vitamin D tablets. So your vitamin D is good for you, but that's not the only thing that's going to help you. You need to have something that will counteract the virus, because we know it's a real virus.
So I guess you came up with quite a few solutions to those myths and misconceptions already. But yes, there are any other ways which we can overcome these?
Well, I would say people have to do their own research. And there is so much data on the internet these days, and you could go to trusted, reliable sources who will actually tell you what it is. Go to your own Black doctors; they will tell you. Yeah, there is I think there's a group called the Caribbean African Network, Health Network, which is from Manchester. They have a number of doctors on there, all Black, and all you have to do is put something to them in a question, and they'll come back with an answer for you.
That's great. That's a great initiative. Are there any other ways you think that we could motivate BAME communities to take the vaccine?
Right. Well, okay. One of the things that you should do is that find out if people have had the virus, how have they actually coped with the virus, and what they did to overcome the virus. And I would argue that majority, at least 80% of people who have had the virus have had the vaccine now because they want to keep safe. I know that some, and I'm not saying it's a myth, but some young people may have had the virus, but they may not have suffered because normally they're very healthy. It's where people have underlying health conditions where it will impact you even worse. So if you're very healthy and you get it, it may be like the flu for some people. And some people, just like the flu vaccine, you don't have to take the flu vaccine if you don't want to. However, if you suffer from any underlying health conditions, it becomes more dangerous, and that's where I would really encourage people to take it.
I guess a thing that we've seen throughout this current period of time is that there's a lack of information, and there's quite a bit of misinformation floating about in the media. So what information would you have liked to have known prior to taking the vaccine, which would have encouraged you to take it?
Well, I actually did a lot of my research before. I got my first shot in January, and actually my first shot was in February, and that's after I actually went through to a lot of webinars talking about the vaccine and whether or not to take it. So I had to do my own research. I spoke to lots of people, and then I actually made up my own mind whether or not it was going to be better for me to take it. Because I'm diabetic and because I suffer from asthma, I am one of those ones that needs to take the vaccine. And that's why, for me, it was a no-brainer.
Yeah, definitely. I can see why that is. We spoke about trust already.
Yes.
Do you trust the current government with their vaccine rollout system?
Right, okay. Well, it's not about the government's messaging. It is about what is your health. And whilst a lot of the messaging coming out from government is very confusing. One minute you're meant to be staying in, and next minute you don't have to. Next minute you could be 1 meter away, or next minute you've got to be 2 meters away. It can be very confusing, and that's why people don't trust the messaging. But the key point is about managing your health. And from a Christian point of view, God wants us to be healthy. He doesn't want to be unhealthy. And there's nothing in the Bible to say that you shouldn't take a vaccine. Vaccines are good. And that I know that lots of ministers have actually come out to say you should be taking it. And those ministers are doing it for your own good.
I guess just to delve into the religious aspects of things a bit more, do you think that there are any religious or ethical barriers which are stopping people from taking the vaccine?
Yeah, there are religions that thing to do with blood, and if they feel that it's going to alter your DNA in any way, they will not want you to take it. Fortunately, I know that these vaccines, all the 3 main vaccines, will not alter your DNA. And that's been scientifically proven it won't. There is the issue about blood clots, but if you take the pill, you could form blood clots much higher percentage than taking the vaccine itself. So from that point of view, it is life is a risk, and there are risks in life, and you've got to measure what is an acceptable risk and what is not an acceptable risk. And that's why I say it's a personal decision for individuals, because you may be much more healthier than I, and you can make a choice not to take it. Whereas I'm not that healthy, and I therefore need to take it because it will preserve my life.
And regarding the government and the media, do you think that enough is being done to prevent the spread of fake news regarding COVID-19 and vaccines?
Well, it's going to be very difficult opening up the internet, which gives people a lot of freedoms, and sometimes they're unchallenged. And that's why I know a lot of footballers now are actually challenging the media to clamp down on either homophobic or racist comments, but you can also clamp down on things which are not true within the media. And I would say that it may be very difficult for the government to do that, but it really is a company's responsibility to make sure that whatever goes out in their name, it's checked, it's verified, and therefore when people read it, they can come to a comfortable view that whatever is put out there, there could be some truth about it.
And my final question for you today is, why do you think that COVID-19 has affected BAME communities disproportionately?
Okay, so what COVID has done is actually revealed the level of inequalities that Black people have suffered in our society. So when you look at people on the front line, majority of people are the Black and Caribbean and Asian communities. So bus drivers, you're talking about road sweepers, you're talking about people in the shops doing services, you're talking about nurses who are actually looking after care, you're talking about sometimes the police and firefighters. They are on the front line, and once they actually have to deal with the front line, it is more easier for it to be transmitted to them. And that's what happened in the early months. A large proportion of Black people, because they're on the front line, transmitted the disease. There is also about making sure that we have to look after ourselves. A large proportion of Black people suffer from things which I suffer, which is diabetes, such as asthma, and such as other underlying health conditions. And it's really for us to make sure that we do our exercise, we eat healthily, and make sure that we don't eat too many red meats, for example. And we start actually looking at our diet, and so that we could look after ourselves, our mental health and well-being, and actually making sure that we do the best we can. A lot of us, because the food is sweet, we're going to eat lots of it. We've got to make sure that we be more disciplined in the way that we look after ourselves.